Thank you very much, and thank you very sincerely to the Texas Biomedical Research Institute for hosting this very, very important conference. I want to particularly single out Dr. Larry Schlesinger and his colleagues, his leadership team at Texas Biomed. This conference has been envisioned, planned, and carried out in a refreshing way. Some of the brightest talent from around the world, knowledge gleaned from the pandemic. At its core, this conference is about going forward. It's about building a better future. Now, all across the world today, there are many settings in which post-mortem meetings are underway, forensic reviews of all kinds, and some will try to fix blame for the pandemic. Some will titillate with juicy side stories. Some are designed to reinforce political biases, and some will try to settle scores. But this conference is about positive actions by responsible leaders going forward. It is, as you know now, having spent this morning, about lessons learned, and it's about best practices. And perhaps that's why there's 200 leaders on this site today and about 500 leaders online. Thank you, all of you, for your participation in whatever form. This is a conference about positive action. Positive action to do two things principally. One, to mitigate or lessen the effects of future mass infectious disease events. And secondly, to prevent to the maximum extent possible future viruses from reaching such a destructive scale. This conference at its core is about the future. And it's time that we reach that point of inflection where our conversations are about going forward. The forward progression of science, which we're learning about today, the proactive application of innovative public health measures, which we're learning about today, and the constructive deployment of societal structures all across our society, scientific teams, governmental authorities, private sector firms, including capital providers, and community-based organizations. I think that's what makes this conference particularly unique and useful. Now, I'd like to take a minute to highlight some of the discussion in the various sessions today, because each of you was able to be in only one concurrent session. One part of the morning, there were 3 concurrent sessions. Another part, there were 2. So it's impossible for everyone to get an overview. But the team from Texas Biomed has provided me with some of the highlights of comments made today that may be useful for all of you to hear in summary. Beginning with Dr. Monroe, who reinforced the tone of forward-looking preparation in her opening remarks. The session on public health and economic interface underscored the importance of understanding the interrelationship between public health issues and the economy. We had raw lessons in that reality over the last 3 years as we had complete lockdowns and then the effects on the economy, supply chain, and so many other dimensions. A real understanding of that dynamic allows us to plan for the future with appropriate priorities, understanding that the likelihood of similar pandemics is not remote. We're likely to see, at least in some parts of the world, if not the entire globe, other instances of this nature with dramatic economic effects. Who would have imagined among economic prognosticators that we would deal with an interlude of this type of 2 years plus of dramatic economic effects? But it's very important to understand from a priority setting dimension going forward. The session on public health education focused on the importance of public involvement in information, the dissemination of information that people need to make their own individual decisions about their health for their families, but also to support broader actions as we saw the importance of explaining the significance of masking, significance of testing, and the significance of vaccines. In many parts of the country, including in this city, a heavy emphasis by the mayor and the county leader on briefings daily, every evening at 6 o'clock on public television, and also on updates by our newspapers and other mediums that made it possible for people to get information they never imagined they would need on rates of infection, on rates of hospitalization, on locations for getting treatments and such. The session this morning on partnerships focused on new and innovative partnerships, not just for scientific research and trials, although what was accomplished through partnerships in that arena was stunning, one could say miraculous, but also for the delivery to the public of tests and of vaccines. Partnerships all across the society were an important part of the response to the pandemic. And we know we want to nurture those partnerships going forward. Another panel focused on the differential impacts of the pandemic, and this particular panel this morning focused on gender, on women and girls who were impacted perhaps more than might have been imagined in terms of the childcare obligations of women in the workplace, for example, and many, many other dimensions. Tomorrow, we'll hear more about other dimensions of inequality, but some of it was touched upon this morning in the session on the economy, where poor communities were inordinately impacted. And I'll say more about that in a moment, although I would say that we know we have these differential realities in our society between that section of the economy that is based on knowledge workers who can work from home and what we took to calling essential workers, which meant people who have to keep the mechanics of the society going forward, whether they would be in transportation workers or food service workers or food packaging or keeping stores open for essential groceries and supplies, mechanics of buildings and automobiles and everything else, air conditioning systems, medical workers, clearly of all kinds at all levels. And those persons were differentially impacted by the pandemic. That is to say, not only in the workplace, but exposure to the virus itself. Very, very, very important perspectives that we gain during the pandemic about the way our society is structured. Some who have said we took the scab off the wound, and what we saw clearly was some of the wounds of inequality in our society. And then there was a session this morning that just finished on community engagement that drove home the significance of nurturing community interest and involvement, which cannot be just switched on like a light when the requirement for it exists. So that gives you just a quick overview of some of the general content in the sessions that occurred this morning. But let me just give you a little more specifics from people who actually had some insights that I think are important to share with the entire group from this morning. Magda Roballo, the managing director of WGH Global, said, "We need to build back equally. The role of public health is to build vibrant and resilient communities where everyone can thrive and live their healthiest lives. A focus on public health, an emphasis on public health generally for the entire society that we've not had before, and the pandemic certainly drove home the unequal access." The CEO of Southwest Research Institute, Adam Hamilton, said, focused on the tension between the time that it takes and the patience to adopt new science, when in certain emergency circumstances, we just don't have time as a luxury. So we're racing against the clock, and that was certainly the case here. He mentioned the need for nimble partnerships as essential to the innovation that is required with speed. Andreas Sider from the World Bank drew some examples of best practices from other countries. He said the Philippines and India had existing frameworks for engaging the private sector and attracting capital to solutions, which helped during the pandemic. Again, emphasizing the point, we can't do things from scratch if we haven't been practicing them, if we haven't been building relationships. very important in every aspect of the pandemic. I mentioned earlier the issues that came out of the panel on women and gender inequality during the pandemic. Tracy Baird said the following in that panel: women have been incredibly impacted by the pandemic and have not had a full share of the leadership space in addressing and solving the pandemic. That certainly speaks to a societal understanding that the impact for women was different. And as we prepare for the future, we have to take that into account. This pandemic really focused on perspectives and observations that we have to learn. Lisa Kolovich, in that same panel, an economist at the IMF, wants to see well-designed, gender-responsive fiscal policies that enable support and access for childcare, parental care, and sick leave, and public health education, which go right to the heart of some of the gender inequalities that the pandemic made clear. Just basic unfairness, because we didn't understand well enough how something that was this pervasive might actually deal with gender in a very different way. There was a session on the economy, one of the early sessions, and one of the focuses was on the pandemic's effect in cities with high poverty rates, which included San Antonio, and some of the recognitions that came from that. I will say in the San Antonio case that Mayor Nirenberg, who will be part of this conference in the next 2 days, offered during the pandemic the public the chance to vote on directing a sales tax to create training funds on a scale never before attempted in San Antonio for the purpose of providing skills for persons who were displaced as they lost their jobs, as industries closed during the pandemic, with a view toward changing their career potential in other sectors. And that passed by a margin of 70% during the pandemic and generated an endowment in effect of $154 million to be used for new forms of training in the San Antonio economy. Rebecca Clay Flores, who is a county official, county commissioner in this county, stated the following on this point. She said, "You can't wait until the middle of the pandemic to build relationships. And that's why this county just allocated $60 million for new public health infrastructure in underserved areas in the southern sector of San Antonio." Again, driving home the kind of ongoing partnership development and thoughtfulness that needs to occur. Finally, with respect to some of these observations, Helga Fogstad issued a call for action that said, thinking about partnerships, PMNCH has developed a 7 asks of partners that make explicit, make clear what a partnership should be based on in recovery plans and also in preparedness plans for the future. Remember, we spoke earlier about the 2 fundamental objectives here, which are to mitigate or lessen the effects of future infectious disease events, but also to prevent, to the maximum extent possible, future viruses from achieving this level of destructive ability. The final point that I would make came from one of the panelists who said, part of the places that have had extraordinary success with respect to the pandemic was based on trust, a pre-existing trust, which made it possible to move at the speed of trust. That's a beautiful articulation of what transpired in particular places where working relationships have been well established. To be able to move at the speed of trust. People being able to accept suggestions, accept initiatives, accept understandings of capacity based on pre-existing trust. And when you think of it, that is certainly one of the intentions of a conference such as this, to extend the bonds of trust among leaders such as those at this conference, people who have worked together in the past, will work together again in the future, and will be ready based on bonds of trust to be able to act in an emergency such as that which we have lived through. This conference, if it accomplishes some measure of that, deepening, reinforcing bonds of trust, will have accomplished a good part of its purpose. Thank you again for being present. Look forward to your participation tomorrow in a continuing conference of great substance. And thank you for bringing your professional skills to this important subject, as you already have, and as we need you to do going forward. Thank you very much.